Hey guys, today we're going to talk about how to assess whether you have a higher risk for disability or not. Now, this is often performed for individuals who are older in age and we're already starting to think about what that might look like in the following years, but it could be additionally valuable for individuals who are recovering from injuries or have a sedentary lifestyle, and so there are lots of folks that this could be beneficial for. I'm Dr. Tim with Optimized Wellness Center, and again we're going to go through a way to be able to evaluate for the risk for disability and the intervention exercises to be able to avoid that and to improve one's balance, as well as functional strength and injury prevention. All right, so this test, the test and the intervention are pretty much one and the same. And this is called the 5 times sit to stand test. And so the evaluation for this test, or the purpose for this, is to increase hip strength and muscular endurance, to be able to do things repeatedly without fail, and to avoid falls. Because falls create obviously injuries, but also it creates fear avoidance and a variety of other kinds of issues that are not good. So the benefits will be, again, improved stability, functional strength, and injury prevention. And the muscles that are involved in this are the gluteus maximus and medius, the rectus femoris, biceps femoris, and semitendinosus, semimembranosus, hamstrings, and the quadriceps. So basically we're going to be working on the muscles that are involved in the front and the back of your thighs, as well as some hip flexor muscles here in addition, and notably your iliopsoas. Okay, so again, the 5 sit to stand test is performed by merely doing 5 repetitions of sit to stand. And then the question is, how long does it take for you to be able to perform 5 of these sit to stands? Now, for some individuals, that might not be a particularly safe thing or advisable thing for them to do, in which case I would suggest that you bring another chair or something else that's stable nearby so that you can perform the test and evaluate this. And so you would have this here, and you could use this chair or some other device like this for stability to make sure that you feel comfortable and safe, such that you don't run the risk of falling or being unstable. Okay, so you could perform that same test by holding your hands here and doing that. You could do that with just merely one hand. And another version of that would be to be able to do it with your hands here on your thighs and pressing up off of your thighs when you are performing this evaluation. The ultimate version of this, though, is to be able to do this with your arms not touching your thighs and just either at your side or across your chest, either way, not touching anything else, and just performing this test. 1, 2, 3, 4, and 5. So for this test, when we evaluate for older individuals, the standard is for individuals who are in their 60s, meaning between the ages of 60 and 69, we would want for an individual to be able to perform those 5 sit to stands in 11.5 seconds. For individuals who are in their 7th decade, so from 70 to 79 years of age, we would want them to be able to perform that in 12.5 seconds. And for those that are in their 8th decade, between the ages of 80 and 89, we would want them to be able to perform those 5 sit to stands in 14.5 seconds. Now you could take a similar extrapolation of these numbers and utilize them for individuals who have recently had an injury, maybe a surgery, or they've been laid off of work for a period of time due to some kind of physical complication, or they have an extremely sedentary job. Potentially they're recovering from other kinds of things, and we could use the same evaluation. Can they perform merely 5 sit to stands in 11 to 14 seconds or something akin to that? And that would be a determinant. If they are outside of that period of time, we would say they have a much higher risk for disability and challenges in terms of recovering adequately. And if they can perform it within that amount of time, that does not abscond them from the responsibility of continuing to maintain their muscle mass and being able to maintain their balance and their strength and endurance, which would mean performing precisely the same exercise in and of itself, which is sit to stand, and repeatedly doing this. Now, specific to the form of how to do this, we want our head to somewhat lead our body as well as our chest, and so it'd be extremely hard to be leaning back and to try and sit to stand. That would be remarkably difficult to do. So often what will happen is, as it relates to the specific form, you're going to lean forward slightly, get your center of gravity slightly over your thighs and closer to your knees. And then as you lean forward, you're going to tip your buttocks forward and pressing up through the mid part of your foot and into your toes, and then stabilizing back onto your heels so that you remain stable on your feet here. So again, you would tip forward, and then you would be able to maintain that balance here, and then repeating that same test. All right, guys, Dr. Tim with Optimize Wellness Center. If this was a helpful video for you, please press the like button and share it with others. Leave us a comment if you maybe have some other ways that you perform this same test or some questions about this, and we'd be happy to help answer them. Have a wonderful day. Take care.